Hey y'all, it's Kirk. So out of the tree and into the truck for the next episode of Ask Dr. Kirk. Keep the questions coming, y'all, because they keep piling up, but it's okay. I'm gonna try my hardest to do these every week, so I'll eventually get to you if we're blessed to keep on going. But here we go for today's episode. So we have Sam in Hazelhurst is who I'm going to give this question credit to because it was first, but I had several people ask the same question. Dr. Kirk, do you believe in holistic medicine, Western medicine, Eastern medicine? What is your slant? That's kind of a conglomeration of several people asking that question. um, I'm in the business of healing. I'm in the business of making people feel better. So the way that my father taught me is there are going to be techniques and there's going to be practices and there's going to be things that come across in your practicing life that you may not can explain. Um, but if I can make people feel better, um, all we have to do is very simply admit that we don't know quite how that did it, but we are super blessed that you feel better. So when it comes to different um, styles of medicine, different regions and stuff. So Eastern medicine as opposed to Western medicine, which we are taught. Holistic medicine, which takes into account all of the entire body instead of just looking at one system or one symptom. All these are fantastic approaches on how to treat people. And people need are requiring different treatment thought processes. Some people are more complex, like we talked about in the last episode. Some people that tend to be some of these zebras, they certainly need a much more holistic look at things so that you're seeing the entire picture and not just focusing on one body group or system in order to heal somebody. So what do I mean by things are going to come up that make somebody feel better? Acupuncture. The literature behind acupuncture is undeniable. Okay, can I explain to you how acupuncture makes people feel better? I can try, but certainly my science kind of falls short on some of it. But look, it hasn't been used in Eastern medicine for thousands of years because it doesn't work. It works. Physical medicine has its place, so that's a perfect example of those kind of things. But understand, even though we can't explain it, we're not trying to fool anybody. I'm not trying to tell somebody, you know, uh, this works because of this and I knew it the whole time. No, maybe I didn't. And sometimes there is such thing as what's called the placebo effect. And the placebo effect is very real. You're getting something that's not necessarily treating you, but I mean, let's face it, a lot of times we're treating what's between people's ears. The brain is very powerful and it can heal a whole lot of your own self. So if we can fool your system into healing some of that stuff, that's okay. A good example would be like the mom that really wants those saline eye drops for the viral pink eye that I'm treating their child with. Is the saline drops in any way helping that viral conjunctivitis? No. Um, but does it make the child feel better? Yeah. So why not? Now, I'm not trying to fool this mother. I'm not in any kind of way. If she asks me, is this really fixing the thing? I'm going to tell her the truth. I'm not trying to fool anybody in any kind of way, but a lot of times we fix people, and it's really the great physician healing them more than it is us, but we're in the business of making people feel better. So when it comes to some of these other practices, Eastern medicine and some of these things, as long as it's not harmful, because my pledge and my oath was to do no harm, have at it. I'm going to very much just give you the information that's available, and I'm going to let you make a decision on it. Go do acupuncture, man. Go do cupping. Go do whatever. Can I tell somebody that, they lit the sun-ripened boysenberry candle and all of a sudden their kid doesn't have asthma? I'm just going to praise the fact that your kid doesn't have asthma. That's awesome. Now, am I going to now prescribe that and tell you, okay, yes, please rub a broccoli on their face and do the Macarena? No, I don't know. I mean, I'm not going to start, saying these things are absolutely there, but there's things in this world that I can't explain and I'm not meant to explain. But if I can make people feel better and I can heal people, I'm going to give you the honest truth. I'm going to give you the honest literature. I'm going to give you the honest scientific stuff that we have, and we're going to give it all to God and make you feel better is what we're going to do. Okay. So thank you so much for that question, Sam and others. That was a good one. Second question today, real quick. So Jody from Hazelhurst, Georgia, wants to know, how come respiratory therapists don't get the shine that they deserve when it comes to treating patients, especially in the trauma situation, the ER world? Jody, I love this question, and I love you, by the way. So respiratory therapists are one of the integral members of our emergency medicine team. Here's the way that Daddy used to put it to me. When we're taught how to treat somebody in an emergency situation, we are taught the ABCs, and you're supposed to be thinking of them in that order. And it used to, well, they've changed it now to where it's the C comes first. But anyway, the point is, ABC is what we were taught for the longest time. And A stood for airway, B stood for breathing, and C stood for circulation. And that's the order that we usually did things in a traumatic kind of emergency situation. And Daddy used to always say, well, look at the first two, airway and breathing. They're the most important. So respiratory therapists, that's their wheelhouse. That is what they do. They are all about the airway and the breathing. So think about in an awful motor vehicle accident kind of situation. We're going to make sure that that airway is clear and everything. And when we get there, the patient has to be breathing. We have to be we have to be oxygenating the blood. So oxygen can get to the brain, can get to the heart, can get to all the vital organs that need to stay alive. Our respiratory therapists are just invaluable. I mean, this is one of the most crucial things for them to do, and it's a great profession. Some of you young folks who are thinking about wanting to do something in the medical field and want a really rewarding job, making somebody breathe better, one of the most crucial things in keeping somebody alive. How awesome is that job? Yeah, there's some crazy hours, just like all the rest of us, if you work in an emergency kind of situation, but to be able to do such a crucial role like that in the life-saving and healing field is pretty dang rewarding. And I love our brothers and sisters in the respiratory therapy world. They do a job that goes about thankless a lot of times, right, Jody? But I think it's one of the most important things, and I encourage anybody who wants to go into that field. I can hook you up if you come talk to me about that career, and I can hook you up with the right people like Miss Jody who asked this question. So thank you very much for that question. This was that next episode. I'm gonna try to get back in a tree, y'all, but hopefully this answers some things. Y'all keep them coming. I really love these questions. I'm having a great time with this. I hope you are too. Love y'all, mean it. Jesus loves you, so do I. You can't do anything to change those two things.